Hello, my name is David Konur. I'm the CEO of Cardiovascular Institute of the South. I'd like to start out by thanking Dr. Walker for inviting me to give this talk today on healthcare costs are unsustainable, and certainly the great work that the entire NCVH team is doing in bringing us a digital series during these most unusual times in our country. Healthcare costs are unsustainable. That's been a topic and a case for, I think, my entire career at this point in time. And I don't know how many of you saw this Harper's article. It was a special supplement about the soaring costs in healthcare and talked about the crisis of the uninsured and the soaring costs, the overutilization of services, and trying to find something to replace the fee-for-service system, which we continuously seem to be trying to do. The interesting thing is that this article came out in October of 1960, now 60 years ago. So the debate on rising healthcare cost is nothing new in this country. In fact, we spend $3.65 trillion on healthcare, or we did in 2018, which amounts to 17.7% of GDP. I remember this debate about national healthcare expenditures as a percent of GDP back from my graduate school years. In 1994, we were somewhere around 13.3%, 13.4%. And at the time, the headlines always were, if we don't change the cost structure, if we don't bend the cost curve, then by the new millennium, by 2000, it was going to be more than 20% of GDP. Here we are now, 25 years later, and yes, it's gone up from 13.4% in 1995 to 17.7% in 2018. And so, you know, the reality is what concerns me the most is what the projections are showing from here on out. And I'm going to share some of that data with you shortly. But just anecdotally, one of my favorite anecdotes about healthcare costs, and I think this came out, the CEO in 2008 said that Starbucks spends more on healthcare than they do on coffee beans. And in 2008, you know, it was trying to make a point about obviously the cost of healthcare. It's been interesting to see how Starbucks has spun that over the years to now say we care so much about our employees that we actually spend more on their healthcare costs than we do on coffee beans. But nonetheless, that's a reality, a stark thing to recognize. It adds thousands of dollars to every car we buy, and you know, healthcare costs continue to rise. My good friend Jerry Blackwell from the ACC and MedAxiom shared these slides with us. Okay, Tom, let me redo that one because my earpiece is about to fall out.
Nope, all good.
Okay. My good friend Jerry Blackwell, the CEO at MedAxiom, pointed out this interesting series of slides and looking at the Bureau of Labor Statistics in 1990, only 30 years ago, the industries with the highest employment in the United States were manufacturing and the retail trade. Only in Nevada was accommodation and food services the highest employer, and then in Washington, D.C., professional and technical services. And we can debate till the cows come home whether Washington, D.C.'s professional or has any technical capabilities. But that aside, and it took 8 years to 1998 for healthcare to really become one of the highest employers and remain from then on out. And that was in North Dakota. You fast forward 10 years, and we're now 2 years before Obamacare passed, and 1 year before Obama came into office, you can see how many states now had healthcare as the industry with the highest employment. And then Obamacare passed in 2010, and boom, you see how healthcare has become the largest employer in a majority of the states. And here we are now. The latest data available through the Bureau is 2015, and it is by far the largest, or the industry with the highest employment across the country. Major sources of healthcare spending, I think the average citizen out there thinks that most healthcare dollars are spent on hospitals, doctors, and the pharmaceutical industry. Reality is that 38% of healthcare dollars spent are in this very large other bucket. 33% of healthcare expenditures are in hospitals, 20% in physician and clinical services, and 9% in prescriptions. So earlier this year, in March, CMS released its National Healthcare Expenditure Projections 2019 through 2028, and there were a number of key findings. The first thing to point out is that they mentioned that the pandemic impact is unknown and was not included in any of their findings. But national healthcare spending is projected to grow annually 5.4% and reach $6.2 trillion by 2028. That's only 8 years away. Healthcare expenditures are projected to grow 1.1% faster than GDP per year, rising from 17.7% to 19.7% by 2028. Among all payers, Medicare is expected to grow the fastest, 7.6% per year, largely as a result of having the highest projected enrollment growth. And lastly, the insured share of the population is expected to fall from 90.6% in 2018 to 89.4% in 2020. And the question then becomes, are we spending our money wisely? We still spend a huge amount of money on the last year of life. In fact, about 19 to 20% of all Medicare dollars are spent on the last 1 year of life. And we don't spend money on preventing these chronic conditions. Why are we not investing much more in prevention? It would make so much more sense if we're truly trying to bend the cost curve. When we look at cardiovascular disease, the American Heart Association in 2017 released its cardiovascular disease cost burden projections through 2035. And the first point that they made was that cardiovascular disease costs more than Alzheimer's, costs more than diabetes. And I think we all kind of already knew that. But some of the things that, I found quite interesting in the report was when looking at the projected cardiovascular disease direct costs by condition through 2035, total medical costs were estimated to increase more than double from $318 billion to $749 billion. When you add to that, looking at the indirect cost, and indirect costs are the costs of the morbidity and premature mortality. So loss of work wages and costs of having sitters because patients bedridden due to the disease. Those are all the indirect types of costs. Again, substantial increases are projected over the next 15 years from $237 billion to $368 billion. And so if you put that all together and you look at it by age, by 2035 across all conditions, total cardiovascular costs will more than triple amongst those age 80 plus and more than double amongst those between the age of 65 and 79, looking at a total cost increase from $555 billion in 2015 to $1.1 trillion in 2035. Just substantial increases in costs expected over the next 15 years. And those cost increases are unsustainable. There has to be a better way.